Engraft is a group of different people coming together to solve problems. There's doctors, there's nurses, there's patients, there's families.
To improve outcomes, to improve the care process, to improve the patient experience, to help providers become better at providing care.
The problem in healthcare is we have difficulty communicating how we individually as a program might solve problems because there's not a natural way to communicate these findings. And also a lot of programs may not realize that they may really be knocking it out of the park.
Not only is there variability in practice between centers, but there's also variability in practice between providers. Engraft gave us an opportunity to work together with families, with patients, with these other providers, with our friends in the community to try to improve some of these outcomes for our patients.
The patients are right at the center of this whole process. Often what we as professionals, and this is true of doctors and of nurses, think are the big problems are very different sometimes from what patients think are the big problems. And that directs us in the right way.
We want to try to standardize care. In other words, reduce variability where we can. But at the same time, patients are different. They have different goals, different needs.
Part of the reason the network came together is to understand the variation across centers and to begin to make sense of it so that we can collect data on outcomes that matter.
But we'll be able to see the data from each center, analyze it, and be able to say, they're doing it better than us, how can we improve? And then if we're doing a really great job, we have the opportunity to be able to help our colleagues at other centers. And it can apply to many different things. So whether it's chronic graft versus host disease assessment, or maybe it's long-term follow-up for survivors, making sure that everyone gets the same assessments that they need.
You're bringing in new thoughts, new ideas from, in our case, 15 different hospitals. So there's always something to learn.
It's most important that we're following these outcomes over time. And as we implement new ideas and hopefully see change, we then can capitalize on what we're learning and then take a next step.
So you'd think everybody would do this all the time, right? And strangely enough, no, they don't. So typically you do scientific studies. It takes about 5 years to do one. It gets published in an article. That takes about 2 to 5 years. Then people all have to read it. Then they have to decide to change it. The average amount of time for a good idea to get into clinical practice is about 15 years. So that's way too long. The best time to solve a problem is now. And to do that, you need everybody there, everybody rowing the boat in the same direction. With Engraft, that strategy, we expect to make important change in less than a year. That's innovation.
This is one of those conditions where you never think about it until it touches your life or your sphere personally. I'm the parent of a bone marrow transplant survivor. We did collaborate with our care providers as we talked to other parents who had gone through the process at the same time. We realized absolutely that was not the norm. This experience for me and my family is something that I bring to the participation in Engraft.
And solving these problems makes everything flow better. There's less stress on the patients, less stress on the staff. Things work better.
Oftentimes, if you just ask the patient, what's important to you, that has implications for the way that maybe you administer care. That understanding itself is an innovation.
This award will lift us up and give us the energy that we need to get to the endpoints that we really want, which is demonstrated, measurable change and improvement in processes.
Over time, we anticipate the network to grow, hopefully to include many, if not the majority of programs in the country.
It's a passion project for all of us, and that's why it works, and that's why we have a lot of joy in working together.
Quality of life, live the best life that you can. That's it. That's why we do all of this. That's why we wake up in the morning. That's why we deliver healthcare. That's why we became physicians, nurses, improve outcomes for patients. Working together, I think we can do that.